Usually, by the time a woman finds out that she has conceived, she is about 5 weeks pregnant because the duration of pregnancy is counted from the first day of the last menstrual period. The curiosity of that woman at this stage to know about the potential outcome of this pregnancy is at its peak. Weird thoughts like falling victim to ectopic pregnancy or molar pregnancy starts to kick in the head. At this stage, when she visits her doctor, she is asked to wait at least 2 more weeks to go for an ultrasound because things that would predict the outcome of the pregnancy would be visible as early as 7 weeks by an abdominal ultrasound scan. Going for an abdominal ultrasound scan before or exactly at 6 weeks of gestation would most probably lead to absence of the signs of viability of a pregnancy, which means the absence of heartbeat because the pregnancy is too small to be picked up by the sound waves of an ultrasound machine. For the mothers eager to know about what is going inside of their wombs, would go for an abdominal ultrasound scan as early as 5 to 6 weeks of gestation. At this stage, no heartbeat would be detected, but the only 2 things that needs to be considered to ensure a good-going pregnancy is the presence of an intrauterine gestational sac and a yolk sac. It's possible that the sonographer might be able to point out the embryo, which at this stage is likely a tiny white curled object. Surrounding the embryo is the yolk sac, which will look like a small white circle. The fetal pole, which would later on become the baby, is very difficult to be seen at this stage. However, a transvaginal scan could appreciate the fetal pole and heartbeat outcomes as early as 6 weeks, but it is usually not recommended because it is an invasive and uncomfortable procedure which is usually done in emergency situations like intolerable severe abdominal cramping with an overdue period to rule out ectopic pregnancy.